Hello, everyone. I'm Tamara Kaliszewski. I'm a faculty member and academic advisor in Allied Health Sciences, and I really wish I was speaking with you in person, but hopefully this will be helpful for giving you some information about Allied Health Sciences as a major and what we will be able to offer in Waterbury. So Allied Health Sciences is one of the larger majors in Storrs, where I'm currently based. We have about 750 students in the major. But in August, I'll be moving to the Waterbury campus, and where we will be welcoming the first class of students who will be able to start and finish Allied Health Sciences as a major in their 4 years there. So we're really excited about that and being able to offer those students that opportunity and that option. So Allied Health Sciences is a great major for students who are thinking about going into a healthcare profession for a few reasons. It's a very flexible major, so there are a couple different concentrations and tracks that I'll talk about, but in each of them there is one student's plan of study may look very different from another student's, and that's designed that way on purpose so that it affords the possibility of several different paths. So you can complete prerequisites for both or for physical therapy programs or for occupational therapy programs, physician assistant programs, medical school, and many others, as you'll see. And so you're able to complete those prerequisites at the same time as completing the requirements for the major. So it's really, and those are the same things. So we're able to fit those prerequisites into the requirements for the major. So you're not doing two different things at once. So that's one or two of the positives about Allied Health as a major. We also offer a lot of classes that are taught by individuals, faculty members who have worked in healthcare and that are based on healthcare experiences and settings, and so students are able to get that early exposure, as well as the possibility of exposure in an experiential learning setting. So part of what I'll be doing when I go to Waterbury is setting up through our alumni networks and through career services and other networks, setting up shadowing opportunities, internship opportunities, patient exposure opportunities for students in the Waterbury area in hospitals and other healthcare settings. So, okay, so let me start with sharing some slides about Allied Health. Okay, so there will be in Waterbury, there will be two different concentrations that are part of the Allied Health major that will be available to students in Waterbury from the beginning. And the first pictured here or explained here is what we refer to as our standard plan, and is certainly the concentration that the majority of our Allied Health students currently pursue. And so with this concentration, we're able to include as part of the major, the prerequisites for many different grad programs, which some of which are listed there on the right. Physician assistant programs, accelerated BSN programs, so those nursing programs that can be completed in 1 year after you've completed a bachelor's. Physical therapy and occupational therapy programs, prosthetics and orthotics, and others. So the plan itself begins with core courses, some of which you may have already completed in high school through ECE courses, so general biology, general chemistry, nutrition, psychology, statistics, and math, as well as the last course listed there, Allied Health AH 1100. And this is a course that's required by all of the concentrations, by students or of students in all of the concentrations. And it's a course that we bring once a week. We bring in guest speakers from the healthcare community, so a different role each week. And those practicing health professionals speak about what their day-to-day responsibilities are like, what the education was like to get there, and their path there, and then certainly are available to answer questions from students who are interested in pursuing that role. So that can be very helpful for students who are still making up their mind or maybe have changed their mind about the healthcare pathway that they want to follow. But it's also helpful for those who already know which direction they want to go, because these are the individuals that you'll be working with and when taking care of a patient, and it's important to know what those roles are. So then the next one listed there are the 18 credits of allied health courses, and these are the courses that I was mentioning are taught by faculty who've worked in healthcare, and some of them are listed here. So students have a choice of a number of different allied health classes that they can take. So some examples: current issues in health, human physiology of health and disease, U.S. healthcare systems, aging, and counseling and teaching. So again, a taste of what to expect in the healthcare environment that students will one day be working in. And then the rest of the upper level requirements are referred to as our related cognates. And so those are courses that speak to what the student wants to do with the major. So those would be the prerequisites for a grad program. So for example, for physical therapy, 2 semesters of upper level anatomy and physiology are required. And for some programs, exercise physiology is also required. So those courses would go into that category to complete that category, or to contribute to that category for the major. Other courses that could then be used would be maybe social science courses that speak to a particular subject like disability, or a particular patient population that a student is interested in working with. So courses from psychology or HDFS or sociology can go in that category. If we're looking at a student who is in the PA route, so interested in applying to PA programs, then there would be more of the upper level sciences that would go into that related cognate category. So the requirements for PA schools would include organic chemistry, microbiology, again, the 2 semesters of anatomy and physiology, biochemistry, and some others. And so that would take care of that related cognate category. Okay, and then the other concentration that will be offered in Waterbury is the health sciences concentration. And so this is pretty similar to the standard plan, but with a couple of differences, one of which is more science requirements and fewer of the social science requirements. Fewer psychology classes that are required, and more physics and organic chemistry. And so this concentration is a good match for those students who are pre-med or pre-dental, and looking to complete the requirements for those programs, as well as pharmacy, optometry, and a few others you see listed there on the right. So again, those core courses are very similar, with the exception of the physics, and the 18 credits of upper level allied health courses. Again, students have their choice of a number of different healthcare related courses. And then the related cognate courses, in this case, for the health sciences concentration, these need to be science-based. And so your pre-med requirements of organic chemistry, biochemistry, cell biology would fall into that category, and complete that category there. Okay, and then of course, I've talked a lot about grad programs, but some of our students choose not to go to grad school after graduation. Some decide to take a few years to join the workforce before grad school, and some choose not to go to grad school at all. And this is a list of some of the different positions that students have gone into after completing our major. So certainly, research assistant positions are a common path to go, as well as positions in more of the administrative side of healthcare, such as the case management, and then the other industries that are healthcare related, such as pharmaceuticals and biomedical industries. So that's certainly a way to go as well, or a potential pathway as well. And again, part of what I will be doing in Waterbury is working with career services, alumni networks to be able to offer internships and other volunteer opportunities for students to begin while they're in their undergraduate and doing their undergraduate work. Okay, so to finish things up, I would love to hear from any of you who, if you're thinking about declaring allied health as your major, if you're still thinking about whether or not to attend UConn Waterbury, if you have already declared allied health as your major and you have some questions about it. So definitely, any of those circumstances, feel free to get in touch with me at the email there. And we can set up a WebEx meeting, or just talk by email or by phone, and then hopefully in the late summer, early fall, I'll be seeing many of you in Waterbury in person. So hopefully that was helpful, and thank you very much.